Hello, I'm Greg Piestecki, and you're watching the Oakland Normal News. As you may have heard, Michigan has become the 13th state to allow the use of medical marijuana by terminal and seriously ill patients with a recommendation from their licensed physician. Voters overwhelmingly chose to protect those who legitimately use medical marijuana to help alleviate their symptoms, 63% to 37%. Michigan proudly joins Alaska, California, Colorado, Hawaii, Maine, Maryland, Montana, Nevada, New Mexico, Oregon, Rhode Island, Vermont, and Washington in asserting the effectiveness of medical marijuana and a patient's right to use medical marijuana with the recommendation and supervision of a licensed physician. Many people in pain have been contacting us asking, "What next?" The phone call or email usually begins with, "I have MS," or "I'm in terrible constant pain," or "I've been using marijuana to control X symptom. How do I go about getting my card so I can be legal?" Here's my take on what happens next. First, the election results must be certified. That takes about 2.5 weeks. After that, I've heard the new law will kick in 10 days from the date the results are certified. What does that mean for patients? Near as I can tell, it means that once the law is in place and you have written certification of your situation. Written certification means it is a document signed by your physician stating your debilitating medical condition and stating that, in your physician's professional opinion, you are likely to receive therapeutic or palliative benefit from the medicinal use of marijuana to treat or alleviate your debilitating medical condition or symptoms associated with your debilitating medical condition. You would be able to mount a medical necessity defense if you were busted. That does not mean that you would be a registered medical marijuana patient in the state of Michigan. The details of how one registers, how much it costs, what forms need filled out, etc., will be decided by the Michigan Department of Community Health, and they can take up to 120 days to say how it works. During that time, many groups will be watching and lobbying the MDCH to make sure they don't impose barriers to legitimate patients and caregivers entering and navigating the system. To be completely safe from a state law perspective, people are going to have to wait a while longer. It may be as late as April until the Michigan Department of Community Health puts a system in place. We are currently researching a more in-depth piece regarding exactly how the Michigan Department of Community Health will be forming the regulations, and we will have more on that in the coming weeks. We are also working on a frequently asked questions list for patients and caregivers, which should be up on the website soon. Until then, please take 10 minutes to go and read the full text of the initiative at www.stoparrestingpatients.org. It's pretty straightforward. A quick read of it would answer many of the questions we are receiving. We'll be right back after this message.
Hi, this is Willie Nelson for NORML. For 30 years, NORML has provided a voice for the millions of Americans who smoke marijuana responsibly. 72% of the public support a fine only, no jail, for social use of marijuana. And yet, 724,000 Americans were arrested on marijuana charges last year because the politicians haven't yet gotten the message. To learn how you can help, contact NORML at www.norml.org.
Welcome back. Americans reject Bush drug war doctrine. Landslide at the ballot box. Voters approve 9 out of 10 marijuana law reform measures. November 5th, 2008, Washington, D.C. Millions of Americans nationwide cast votes Tuesday in favor of marijuana law reform, approving 9 out of 10 ballot measures seeking to liberalize penalties on cannabis use and possession. In Massachusetts, 65% of voters approved Question 2, which replaces criminal penalties for the possession of up to 1 ounce of marijuana, punishable by 6 months of jail and $500 fine, with a civil fine of no more than $100. more than 1.9 million Massachusetts voters and all but 3 cities backed the measure, a greater total than the number of voters who endorsed President-elect Barack Obama, which was 1.88 million. Question 2 is expected to become law within 30 days, making Massachusetts the 13th state to decriminalize the personal use and possession of cannabis. However, opponents of the measure, which include the state's governor, attorney general, and all 12 state district attorneys, note that lawmakers still have the legal option to amend or repeal the new law. In Michigan, 63% of voters approved Proposal 1, which legalizes the physician-supervised use and cultivation of medical cannabis by state-authorized patients. More than 3 million voters endorsed the measure, which received approximately 150,000 more votes in Michigan than did Obama. Proposal 1 goes into effect on December 4th, at which time nearly 1/4 of the U.S. population will live in a state that authorizes the legal use of medical cannabis. Thousands of voters in various municipalities also backed local ballot initiatives supportive of marijuana law reform. In Arkansas, 66% of the 67,000 Fayetteville voters approved Question 16, which directs law enforcement to make activities related to the investigation and prosecution of adults who possess up to 1 ounce of marijuana their lowest priority. The measure also requires a city clerk to submit letters to state and federal legislatures urging them to take immediate steps to enact similar deprioritization laws. In Hawaii, Big Island, population 172,000, voters approved a similar initiative, Ballot Question 1, which directs law enforcement to make activities related to the investigation and arrest of adults who possess up to 24 ounces of cannabis and or 24 plants their lowest priority. The measure, which voters backed by nearly a 3-2 margin, also forbids the county council from accepting government funding to promote federal marijuana eradication efforts on the Big Island. In Massachusetts, voters in 4 state house districts, encompassing 15 towns, passed non-binding public policy questions directing each state representative to vote in favor of legislation to legalize the medical use of cannabis. More than 70% of voters in each district backed the measures. Finally, voters in Berkeley, California endorsed Measure JJ, which eliminates local limits on the quantity of medical cannabis that may be possessed by patients and liberalizes municipal zoning guidelines for patient dispensaries. By contrast, California voters rejected a statewide sentencing reform measure, Proposition 5, which sought to expand the diversion of nonviolent offenders to drug treatment and would have decreased minor marijuana penalties to a non-criminal infraction. Numerous politicians, including Republican Governor Arnold Schwarzenegger and Democratic U.S. Senator Dianne Feinstein, joined forces with the law enforcement and the California Beer and Beverage Distributors Lobby against the measure, which gained just 40% of the vote. Voters on Election Day demonstrated overwhelmingly that they favor political reform in this country and that reform includes new directions in marijuana policy, NORML Executive Director Alan St. Pierre said. These election results emphasize that the voters are well ahead of the politicians when it comes to the decriminalization and legalization of cannabis for adults. Let us hope that President-elect Obama and the Democratic majority in Congress recognize that marijuana law reform is a populist issue. Voters should not have to take to the ballot box to enact sensible marijuana law reforms. These reforms should be championed by their elected officials. We'll be right back.
Get up, get up, get up, get up, go! Get up, go!
Got stickers? Oakland County NORML does not endorse the random stickering of other people's property, both public and private. All rights reserved.
Welcome back. From the Detroit Free Press by Dawson Bell. Voters pass Proposal 1. Support letting severely ill grow own pot. Michigan voters favored sanctioning the use of medical marijuana to treat debilitating illness Tuesday, apparently rejecting arguments that doing so would increase crime and juvenile drug use. The marijuana measure, Proposal 1, led 63% to 37%. When it goes into effect, 10 days after the vote is certified later this month, patients suffering from cancer, glaucoma, HIV/AIDS, and other conditions can be authorized to cultivate, possess, and use marijuana without fear of persecution under state law. Michigan becomes the 13th state to approve medical marijuana, meaning that 1 in 4 Americans will live in a place where the use of the herb for medical purposes will be legal, according to advocates for legalization. Bruce Merkin, communications director at the Marijuana Policy Project in Washington, D.C., said Tuesday evening he was optimistic about the prospects for Proposal 1, but not quite ready to declare victory. Bill Schuett, a Michigan Court of Appeals judge who was co-chairman of the anti-Proposal 1 campaign, said, "I think we waged a good fight. I think we had a good argument. It just looks like we came up short." MPP, which advocates for marijuana law reform around the country, was the primary backer of the initiative, spending $1.5 million in Michigan to collect petition signatures and put the issue before voters, then another $227,000 in the final days of the campaign to counter a late-starting opposition campaign. The initiative was opposed by law enforcement and medical organizations that claimed medical marijuana in other states, especially California, led to widespread abuse, criminal drug trafficking, and easy access for young people. The coalition formed just 2 months ago and raised only $125,000 to spread its message, producing a single TV commercial that aired in the campaign's closing days. The opposing argument was so blatantly dishonest, we hoped voters would see through it, and it appears they did, Merkin said. Patients would be limited to growing 12 marijuana plants and possessing 2.5 ounces at a time. We'll be right back.
Hi, this is Willie Nelson for NORML. For 30 years, NORML has provided a voice for the millions of Americans who smoke marijuana responsibly. Thousands of sick and dying patients find marijuana effective as a medicine, including cancer, MS, and AIDS patients. 9 states have legalized its use. To learn how you can help, contact NORML at www.norml.org or call toll-free at 888-67-NORML.
Welcome back. From the MichiganLiberal.com, Bill Schuett, Hippie Stoner from the 60s, by Eric B., Tuesday, October 28, 2008. From MERS, the Michigan Information and Research Service. Appellate Judge Bill Schuett, the public face behind the anti-medical marijuana campaign, has acknowledged that he used marijuana in college and that the pro-Proposal 1 folks say that's proof that pot isn't a gateway drug. The subject came up Thursday on the Frank Beckman Show on WJR 760, and Schuett reiterated today that any exploitation of his youthful transgressions is a low blow. But Diane Byram, spokeswoman for the pro-medical marijuana campaign, noted that Beckman asked the question about who used marijuana, and she said the question was relevant because Schuett was making the argument that marijuana was a gateway drug into harder substances. It wasn't a gateway drug for you, Byram said. In 1987, then U.S. Rep. Schuett acknowledged he smoked marijuana in his youth as part of a congressional-wide shakedown on the subject. To bring the issue up again is, quote-unquote, old news. Well, Judge Schuett, I'll tell you what's a low blow. A low blow is trying to look tough on drugs, getting your name out in the public for a possible run for State Attorney General in 2010, using the pain and suffering of seriously ill patients as your stepping stone. A low blow is shamefully misleading people about what Proposal 1 would cost, and I quote from your organization's website, quote, requires a costly new Lansing bureaucracy to license marijuana users and will result in vast new regulatory expenses, all coming at a time when the economy is on the rocks, the budget is in the red, and taxes are going up, unquote. I would have thought that a judge capable of reading the initiative and understanding that is self-funding, not costing taxpayers a single dime. I believe we have your Vote No commercial handy. Let's roll it to show how you and your organization tried to scare Michigan citizens by insinuating the results of passing Proposal 1.
After California passed a law just like Proposal 1, hundreds of pot-smoking clubs opened in strip malls all over the state. They grow pot there, they smoke it there, in every neighborhood, just blocks from schools. Vote no on Proposal 1.
A low blow is trying to scare Michigan citizens with claims of pot shops opening up in strip malls across Michigan. Your misleading commercials try to convince Michigan citizens to prevent licensed physicians from recommending medical marijuana to their patients with debilitating diseases with the hope of improving their quality of life. Now, if Judge Schuett would have actually read Proposal 1, he would have noticed that Proposal 1 does not allow for pot shops or grow-ops. It does allow registered patients to grow their own supply or allow a registered caregiver to grow for up to 5 registered patients. That is a far cry from pot shops in every strip mall. And finally, a low blow is not being reminded that you have admitted to using marijuana in your youth and that it didn't function as a gateway drug for you as you are claiming it would be for everyone else. I have no problem with people with opposing points of view, but I do have a problem when someone who happens to be a Michigan Court of Appeals judge and should be able to read the text of the initiative and understand that text, campaigns against the initiative using such disingenuous tactics as those used here recently. Shame on you, sir. That's it for this edition of the Oakland Normal News. I'm Greg Pisecki, reminding you to stay safe and stay smart.